Welcome, welcome. Wellness Wednesday. Ask the doc. Come on in. See my signs there. This girl is on fire. Hello, welcome. I see you coming in. The sign next to this girl is on fire. The one with the heart says, Empowered Women Empower Women. Hey, Brenda. Hi, Pagni. Hi, Perry girls, Perry sisters. Hello. The sign to the other side of this girl is on fire. It says, Believe in your inner Beyonce. Hey, Dustin Doc. Hey, Heather Weber. Hello. Welcome. Welcome, guys. Let's flip it around. Hi. Hey, welcome. How are you guys doing today? Bubba Man, hello. McFanny, hello. How are y'all doing today? How's your hump day so far? Fabulous. Excellent. 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 Well, come on in. To introduce myself, my name is Dr. Nicole Swiner, otherwise known as Doc Swiner. Yep. Good. All right. So if this is your first time, good. I'm doing okay today. This is your first time. This is PeriGirlsTV. Welcome, welcome. If you've not seen us before, we are a group of supportive women on live broadcasting, Periscope, 11,000 strong almost. Supportive, very serious about our business, serious and motivated to support each other and support one another in our goals to further whatever cause we're about, whatever thing that we're doing on Periscope, on live broadcasting. So PeriGirls.com is a wonderful website and organization on all social media to join and be a part of. And this is hello, Bitter Kumquats. Welcome. Welcome for everyone coming in. As soon as my PG Ninja and my other PeriGirls sign on, they'll also put up the name of the website, particularly so you can join with us for our live TV shows on Periscope. We have a couple of them throughout the week. Hey, welcome. So PGTV, hi WebEV, my Perry sister. PGTV is fun. It is helpful. I mean, I don't know, how many shows do we have now, girls? Do you know? Hi, how many shows do we have now, WebEV? We have a show about real estate, wine tasting, yoga, healthy living. I'm your Superwoman Complex expert and family doc. I mean, we have a lot of shows. Yeah, we have lots of shows. So put up that website for me. I think it's our TV guide. Someone will throw up the website so you can hang out with us. But I am here. There you go. PGTV guide.perigirls.com. Yes. So I am your family medicine and Superwoman Complex expert, which is about stress and mental health and women's health and all things family medicine. So I am your Wednesday show at 1:30 p.m. Eastern Standard Time. Welcome, Natalie Crew. I see PeriGirlsTV coming in. Welcome, guys. Disclaimer. There you go. Ms. Weber is reminding. So I'm a full-time family doc. I see lots of patients. I treat them in my way with my knowledge, my background. But if you have any concerns about your own personal individual health, please don't hesitate to contact your own primary care providers and see your providers. Okay. Welcome. Welcome. So again, I'm Doc Swiner, and I usually talk about whatever, family medicine, women's health, stress relieving type things that come to mind. And last week we had some votes to talk about thyroid and hormonal issues and how that can relate to stress, etc. So we're going to talk a little bit about the hormones in the glands. So for my guys, don't run. You have hormones and thyroid levels and all that too. So this is, this pertains to you as well. So please stay tuned. And I see my Perry girls, my PG ninjas, if y'all can catch my trolls for me. Wink, wink. I know you got my back. All right, guys. So the rules are hearts, which you're already doing. And you got it, Weber? Good. Miss Heather got my back. So hearts. And please invite followers, share out on Twitter, share out on Periscope. We want to share this information. I want you to get some good information from an actual practicing physician and not from websites and TV. Okay, we'll leave it at that. So welcome again. All right. So let's talk about your thyroid. So everyone point to your Adam's apple. Everyone has one, men and women. Adam's apple. The tissue that sits on top of your Adam's apple is your thyroid gland. So it's kind of a butterfly-shaped gland. Some of us have larger ones than others. The butterfly-shaped gland that sits right on top of your Adam's apple. Everybody has one. Everyone's born with one. Some of us have more or less activity. Hi, PG Ninjas. Welcome. Have more or less activity of these thyroid glands, and they can be a little bit of a nuisance sometimes. Most of us, hi, good to see you. Most of us have zero trouble from our glands. I mean, they do what they're supposed to do. They help with our metabolism. Hopefully, they help with our mood, our weight, keep things kind of stable, and we never have a problem with them. But occasionally, issues can pop up, whether that be because of family history. You're hypo? Okay, good. So you can help us if you want to share. You can help us with some of these symptoms that we'll talk about in a minute. But sometimes family history gets in the way. Sometimes medications get in the way. Sometimes our other hormone levels can get in the way and interact with what our thyroid is trying to do. So the important thing to know, again, pointing at your Adam's apple, is that's where your thyroid is located. Okay, not below, not around, it's right there. And you probably won't feel it. If you don't have a goiter and don't have a nodule, which you should not for the most part, you won't feel it at all. But the other important gland that's important to the thyroid is the pituitary. And if you have an arrow that goes here and here in the middle of your brain, your pituitary gland, it looks like almost looks like a little boxing bag. You see, people, that's what, in anatomy class, that's what it looks like. It's shaped like a little box, a fluid sac. That's right. But it's, right here, right in the middle of your brain. Your pituitary gland is kind of the main gland, or one of the main glands that has to do, hi, Coach Mo 411. Thanks for retweeting. Has to do with the production of hormones and, antibodies that talk to the rest of the body. Hey, welcome. So those are the two main things we're going to focus on today, thyroid and pituitary. Okay. And to draw things back to the superwoman complex, stress, anxiety, mood, mental health issues. Unfortunately, if those hormones are out of whack, you can feel out of whack in a lot of different ways, particularly with stress and anxiety. So we'll talk about how those things are related. Okay. So, yes, here we go. Brenda's ready. She's like pen and pad, sign and symptoms. Okay. So if your thyroid is normally acting, you're feeling good. What I do in my practice is, and I treat a lot of both women and men, but a lot of women in particular with hormonal issues. But during my physical exams, when you're coming in, you're feeling good, you're feeling healthy, nothing's going on, I feel. So if you ever have your doctor kind of put their hands here and have you swallow, if it's nothing there, normal thyroid, you won't feel anything when they swallow. But if they have a nodule or they have an enlargement or a goiter, you'll feel some enlargement there. Okay? Your thyroid hurts? It hoits? It hurts? I'm sorry to hear that. And they shouldn't be, hopefully the exam itself doesn't hurt. It shouldn't be pressing that hard, but grades, okay. So we have a couple of folks who have some thyroid issues. Okay. So you guys can chime in and let me know about signs and symptoms. But during my normal physical exams for men and women, I feel. The other thing that I do is I often check a blood level for TSH, which is your thyroid stimulating hormone. That's kind of the usual basic screen that I'll do for anyone, usually of adult age. Don't always do it for children, but of adult age, I usually throw in a TSH every 6 months. Yep. So I keep an eye on that because the thyroid can be sneaky. Often you don't know it's happening or it's, too high or too low unless you get it checked. Yeah, good. I had my labs checked today. For those of y'all who follow me on Instagram at Doc Swiner, I put up a picture. I had my physical done today. So yes, I had my labs done today. Yes. Get checked out, have my physical exam, have my labs, and I ask for my TSH to be drawn too with my labs. And so thankfully, I've not had any trouble with it, but I keep an eye on that pretty much every year just to check. So if you have some enlargement, have a cyst, have a nodule, occasionally, or most of the time, you may not even know. Occasionally, I'll have patients come in saying that they feel some enlargement. They've noticed that their neck has grown in size. Family members or loved ones have seen that this area looks swollen. They'll come in, or like one of our folks said, they'll feel some tenderness, some pain there. They'll come in, right? If that's the case, we definitely want to check. I'll be yelled at next week for that. Oh no, WebEV. We got to talk about that A1C. Make sure that sugar is under control. I check it yearly. So I check the guidelines of that. So everybody has their own, way of doing things. Hi, Silverhawk, welcome. But I check the guidelines. Okay, so that was a symptom that your husband noticed that your voice changed. Yep, because it's right around the voice cords, the vocal cords. I checked the guidelines. So the USPSTF is a collection of primary care guidelines and recommendations. It's USPSTF for United States Preventative Services Task Force. And it's hi, Durham Skywriter, welcome. It is kind of the list of formal collection of recommendations that we follow for preventative care. There you go, USPSTF. If you look this up online.com, as of 2015, welcome Durham Skywriter. It's one of my local friends from Durham, guys. The official guidelines as of 2015 say that there is insufficient evidence to say that it's either beneficial or not to check a screening TSH for people who have zero symptoms. So the medical world is kind of, they're on the fence. They're saying there's not really a whole lot of evidence that it helps. So everybody gets to make their own decision about works with their practice. I check them yearly for almost everyone of adult age. Okay, because we'll catch it sometimes. We'll say, oh, look at this. Your TSH, your thyroid levels are off. We may need to do something about it. Okay, so going back to signs or symptoms. Most people don't feel any problems at all. Feel on exam, usually normal. But if you come in and you're having pain, you're having difficulty swallowing, feeling like you're having some compression, your husband, your loved ones, like one of our folks said that her voice was changing. If you're having those things, you go in and get checked. The usual next step is checking blood level. So I check a TSH, which is, by the way, the hormone that's released by the pituitary that talks. Hello, everybody, those that are signing in a little bit late. You can watch the replay to catch up on the front end. But the pituitary releases TSH, talks to your thyroid gland. Thyroid gland releases T3 and T4. Those are your active thyroid hormones. Those are the ones that actually circulate in the body and do things, right? Weight changed. Yep. Hello, welcome, Green Ginger. Yes. So you come in, thyroid's bothering you, enlarge, get your labs checked, they're abnormal. What does that mean? So, actually, let's throw out a pop quiz. For hypothyroidism, what are some of the symptoms? If your thyroid activity is too low, yes, get your labs checked often. I got mine done today. I didn't faint. Sometimes you feel cold, very good, WebEV. So for low thyroid function, weight gain, very good. Thin hair, fatigue, y'all got it. Y'all know about it. Good. Yes. What about the bowels? What can happen to the bowels with low? There you go. You got it. Good. What about the skin? What about the skin? There you go. Y'all are good. Hypothyroidism. So just think, the thyroid gland is there for metabolism, for energy, for weight stabilization. Just think, if it's low, think of everything shutting down. Bowels don't want to move, constipation, very good. Dry skin, weight gain, trouble losing weight. So you're trying to lose weight, you can't lose weight. Some of us wish that our thyroid levels were abnormal because then if we correct it, right, brain fat, there you go, good job. Yep, lots of weight changes. Yep. So just think, everything's shutting down. So slow, sluggishness, fatigue, weight gain, low energy, low concentration, heart rate slows down. Sometimes your heart rate's sluggish. Okay. All those things can happen. All right. So think about the opposite. Hyperthyroidism. What happens with hyperthyroidism? Some things you may not even know about. Blood pressure was too low. That's with your hypothyroidism. Yep. So tell me about hyper. What happens with hyper? Thyroid levels too high. Bulging eyes. Very good. Protrusion. Some people you'll see there. Too much sugar. Weight loss. Good, Christine. Good. Hyperthyroidism. Thyroid's too overactive. Too much metabolism. Right. Can't sleep. Right. Mood stuff. Hypothyroidism. Depression. Lowness. Hyper. Anxiety and panic attacks. Very good. Very good. So, okay. Again, this is textbook. Sometimes you can have a mix of different things. Heart rate too high with hyperthyroidism. Very good. So everybody's different. Weight loss, too much potassium. That's right. That's right. Other things that you can't necessarily feel with hyperthyroidism. We worried about your bone density. We worry about osteoporosis. And we worry about the like actual function of your heart. So congestive heart failure. You know, if things are having to work too hard all the time, best friend is hypo. Bless your heart, PG Ninja. So do y'all balance each other out? You're too low, she's too high. It's, yep. Sometimes it can be the content of iodine, which is the main ingredient in salt. Iodine. Yep. Hashimoto's. Yep. So Hashimoto's and Graves' disease, the way that I remember Graves' disease, and I always have to think about this and not get this wrong. Graves is when you're too high, end up in a grave. That's the way I think about it. It sounds horrible, but that's the way I have to remember it. Too high of a level of your thyroid levels, ending up in a grave. Hashimoto's, the opposite. Okay. But you can have different mixtures, and Graves and Hashimoto's are more antibody, often hereditary, but they are immunoglobulin in your bloodstream related. So it's not just your TSH was abnormal. Right. No, drink the water. Right. Just get the water in Kansas. Hopefully not. So yeah, sometimes if you have a nodule or a cyst or a tumor or a growth, you have to have your thyroid removed. Yeah. Sometimes it comes out of nowhere, PG Ninjas. Yeah. So we've reviewed kind of the signs and symptoms. So if you're feeling sluggish, you know, often for my folks that come in, you had a goiter. Yep. Sometimes with a goiter, because we see it so much, it's fairly normal. If your hormone levels are normal, if your TSH and your T3 and T4 are normal, we may not do anything for it. We may just keep an eye on it with an ultrasound. Okay. An ultrasound. But if it gets too large, or if it gets in the way of you feeling like, you know, you can't swallow and your voice is changing and all that, you may need to have some treatment. And if you need treatment, like any nuclear treatment or iodine treatment or radiation, something that's outside of medication, then very good. Nova Atkinson, that's right. Then we'll get endocrinologists. Numbers are normal. You can feel crazy. Sometimes you can, depending on the activity level. So if someone's levels are normal and they're still feeling symptoms, sometimes I'll do an ultrasound just to see. Either one. You don't necessarily have to be on Synthroid. So Synthroid is one of the replacement medications for hypothyroidism. You don't necessarily have to be on it forever. I mean, some people's levels, because even when you're on medication, your thyroid level, if you still have a thyroid gland, if you didn't have a surgery like one of our folks said, sometimes your levels still go kind of up and down, up and down. You have to always watch it every 4 to 6 months. But sometimes it'll fool you. Sometimes it'll level out and you feel fine, and you can come off Synthroid. How many of you know about some of the natural things that people are talking about with thyroid, or the alternative treatments for hypo? Radiation treatment, yeah. Once you've had either your thyroid removed or radiation treatment, usually the thyroid function is gone. Armor thyroid, that's right, Christine. So armor thyroid is one alternative way to take medication, but it's more natural. So it's usually made from the actual thyroid gland of animals, cow, pig. That's usually what armor thyroid is about. People swear by it. They take it. I do have some patients that choose to do that because they feel it's more natural than Synthroid. Nature thyroid is one now. Yep, that's right. A little bit harder to manage, with Synthroid. I can do a calculation. I can look at your numbers and know what dose to change up to. Armor thyroid and nature thyroid are a little bit more nuanced. You have to kind of figure it out. Yeah, so those are some of the homeopathic types, BG Ninja. So that's for hypo. Hyper, when it's too overactive, we talked about iodine, talked about radiation. There's good, that's a pretty low dose. 325. Methimazole, uracil, PTU. I don't use those as often. I very often see hypothyroid. I don't as much see hyper. Okay. There you go. PTU is for hyper. Methimazole is for hyper. Okay. It can be stressful because, again, if you're too low, you can have depression. If it's too high, you can have anxiety. But usually with the correct diagnosis and getting treatment, things can level off. There are even some psychiatrists, some studies being done on the use of, even for women and for people who have, let me check my time, normal thyroid levels. there have been some studies that adding just a little bit of T3 or T4 to their regimen can kind of give them a little boost of energy, a little boost of mood. Okay, 11 minutes, thank you. Y'all know my phone starts to act funny around the 25 mark, so I'm keeping an eye on that. But treating people with things like Cytomel, which is active T3, active T4, don't jinx it, you're so funny, can actually elevate the mood, elevate energy. So I'm so tired. Yeah. Well, go and make sure you get rechecked, Nova Atkinson. Make sure that your levels get rechecked. You may need an additional boost. So yes. All right. What else? What other hormonal things? So I think someone threw out adrenal glands. Adrenal glands are the like triangle shaped glands that sit on top of your kidney. Those things are very important for, talking to the ovary, talking to the thyroid, talking to the pituitary gland to regulate estrogen, progesterone, all the other main hormones. Cortisol every 6 months. Yep, every 6 months. Yep. Well, yeah, I wasn't going to correct you. I was like, 195, I don't think it's a dose. 175 is the dose. Yes. So all these glands are yes, I can. So bioidentical hormones are natural alternatives to prescription things. I won't give more levothyroxine. I wonder why. Okay, maybe they don't make that in that levothyroxine. Levothyroxine is Synthroid generic. So bioidentical hormones. So when we treat people with Premarin or Prempro or estrogen because of menopause, those menopausal type symptoms. Am I frozen? Uh-oh, I'm back. I'm sorry, guys. Phone. See, I jinxed it. Bioidentical hormones are the alternative. So you can, welcome. You can go to a compounding pharmacy where they can actually make the ingredients to give you supplements like, they can make up an estrogen like, I know PG Ninjas, I won't say it. I'm not gonna say it. They can make up natural ingredients. Welcome, y'all. Welcome, Constantine Akon. Okay. They also can prescribe things like evening primrose oil, or soy-related things, or black cohosh. These types of minerals, vitamins, supplements can give you the same benefits, potentially, as some of the prescription hormone replacements, but hopefully without the side effects and the complications. So it's very helpful if you're suffering. Yes, that's me, by the way. Doc Swiner, welcome to PGTV. You can either have prescription replacement of your hormones if you're having hot flashes, night sweats, mood changes, vaginal irritation, all that. Or you can try some of the natural things, like the things that we mentioned, or go to a compounding pharmacy where they can actually do like saliva testing or other fluid type studies. I'm speaking your life, hormones, postmenopause. Women, man, we go through so much, don't we? We go through so much. Where they can do things of that nature to, hopefully I didn't go away. I had a phone call, jump in. Okay, sorry. Well, they can treat you naturally so that you don't have those bad side effects. Wonderful. Okay. What other questions do you guys have? Yeah, good questions. Yeah, good question. Who is my lady? Where's my lady with the great